So I'm going to go over the bills that we opposed this legislative session. There are 5 primary bills. The first has to do with eliminating the religious exemption to school vaccination mandates. This is S 1557 and H 2554 presented by Senator Kennedy and Representative Vargas. Then there's S 1618 presented by Senator Rausch, which is known as the Community Immunity Act. And then S 1244, H 1815, Senator Rausch and Representative Sally Kerans. The first set of bills to oppose are S 1557 and H 2554, and these bills eliminate the religious exemption to school vaccination requirements. They also make school immunization reporting mandatory. Right now, it is voluntary, although many of the schools do report. This bill would eliminate the religious exemption that exists currently for kindergarten through 12th grade students, and it would apply to public schools and private schools and charter schools and parochial schools. All of the schools would be included here. While it doesn't address daycares and preschools and camp requirements, the religious exemption is included for those groups or those programs in the regulations. And we believe that it's possible that by eliminating the religious exemption in the statute in Chapter 76, Section 15, it would provide a basis for eliminating the religious exemption in daycares and preschools and for camp requirements. It's not entirely clear, but I think it's reasonable to assume that that would be the case. We urge opposition to eliminating the religious exemption on several bases, including that Massachusetts has the highest school vaccination rate in the country. In other words, we are protected. And given that the religious exemption is used by such a small percentage of Massachusetts students, it's really unnecessary, and eliminating it won't materially increase vaccination rates in the Commonwealth. Only 1.24% of Massachusetts kindergartners used the religious exemption in the 2023-2024 school year. And as far as the raw number of kindergartners who used it, that represented the same number as in the prior year and less than the number of kindergartners who used a religious exemption in the 2013 and 2014 school year. Also, removing the exemption fails to address the much larger unvaccinated population that doesn't use an exemption of any kind. This is known as the GAP population, and they're described by the Massachusetts Department of Health as the students who don't have all the required vaccines and also do not have an exemption on file. For the 2023-2024 school year, that represented 4.2% of Massachusetts kindergartners, so several times more than the rate of religious exemptions in that same grade. This act is also discriminatory. It clearly discriminates against a small group of people with diverse, unpopular religious views. And interestingly, there's a federal law that requires admittance into public school homeless students who don't have all their immunizations or they don't have a record of their immunizations. So the law says you can't exclude them from school on that basis. So really by excluding children with religious views that oppose vaccination, it's expressing some degree of hostility towards that group of people who would be prevented from attending school, even though you have another group of people who also don't have all the required vaccinations, but for a non-religious reason. On the other hand, our current law is not discriminatory. It respects First Amendment freedom of religion, and it strikes the proper balance between public health goals and religious liberties. This religious exemption has been part of our Massachusetts vaccination laws for decades, and nevertheless, Massachusetts vaccination rates have remained very high, the highest in the nation. So, in other words, it's working very well. And if Massachusetts public health officials want to increase vaccination rates, they should instead focus on the gap, which is the larger unvaccinated population. And this gap rate is exemplified in this table here, and it's broken down by county, and it's for 12th graders in the 2023-2024 school year. And it shows, the number of schools and the number of children in each county at those schools. And then it shows the medical and religious exemption rates and then the gap rate. And you can see the medical exemption rates are tiny. The religious exemption rates are quite small. And then the gap rates are quite large, huge in comparison to the religious exemption rate. And if you go just to the far right column and you see the number of children represented in the gap population for each county, if you just eyeball them and then just hit the bottom number, that's almost 11 times the number of children who have religious exemptions in 12th grade. So just to restate that, there are 11 times as many children in the gap, so who are not up to date with all vaccinations, as there are children with religious exemptions. And this is the 7th grade numbers for the 2023-2024 school year, showing by county the number of schools, number of children, and then the percentages with medical exemptions, religious exemptions, and in the gap. And again, you see here the number of children in the gap is several times larger than the number of children with religious exemptions, just raising the logical question why they would target religious exemptions rather than the much, much larger number of children in the gap population. The other thing we want legislators to consider is that excluding children from school will have lifelong adverse consequences. And these adverse consequences will disproportionately impact those who are unable to homeschool for whatever reason, either because they don't have the education themselves or because for socioeconomic reasons, you have two working parents and both parents need to work. And then perhaps most importantly, the special needs population who really depend on their IEPs, their PT, their OT, speech, and other services and other therapies that are provided in the school setting. And those kinds of services and therapies are just not easily or affordably duplicated at home. We also have to consider the mental health impact on all these students who would be excluded from school in a period in our society while we're really suffering from a mental health crisis. And we know from COVID that excluding children from school was considered one of the big mistakes that was made. And we're still recovering from the learning losses that took place while schools were closed and we were shut down. And it's not hard to see that the MCAS scores have really, by and large, not recovered from their pre-COVID levels. And opposing this legislation is consistent with DEI principles. Massachusetts hails itself as a place of diversity, equity, and inclusion, and that should apply to those with diverse religious beliefs as well. We shouldn't be excluding those children from school. We should have equitable access to our public education, and that should extend to the minority of religious children who exercise a religious exemption. I think it's fair to assume that the legislators' increased motivation to pass this legislation to eliminate the religious exemption has been charged by our current political climate, which is, a reaction to Donald Trump coming back to the presidency, RFK Jr. being appointed head of HHS, and then, of course, the measles outbreak in Texas and in other parts of the country. Also, Massachusetts may be feeling some pressure to follow suit of our neighboring states in New York, Maine, and Connecticut, and then, of course, across the country in California, where they've all eliminated the religious exemption to school vaccination mandates. It's important to note, though, that we do have one state where they didn't have a religious exemption for years, and it was recently added back, and that was in Mississippi. As far as measles go, and it does seem clear that there seems to be an extra push to advance these bills this legislative session, in particular as a response to the measles outbreaks that are occurring. There are a number of responses, however, that should be made to address these concerns. Perhaps primarily is that Massachusetts is protected on a population level with measles vaccination. Now, this shows the last 5 years of measles vaccine uptake, MMR uptake, for each of the grades, kindergarten, 7th, and 12th. These are the grades for which reporting is asked for or required, although it's not mandatory from the schools in the Commonwealth. And you can see this shows that our vaccination rates for MMR are hovering very close to 100%. In the most recent year, we're at 98% for 12th grade, 97.9% for 7th grade, and 96.3% for kindergartners. There was a slight dip in the numbers in 2021, which we believe is attributable to COVID lockdowns and access to vaccination rates. The other thing to or access to well visits. The other thing to consider, too, is that kindergarten numbers might be a little bit lower than you see how they creep up for 7th and 12th grade, and that may simply be a matter of timing, that when the parents report or submit their vaccination records to the school, the child hasn't yet received their second MMR, which is generally given between 4 and 6 years old, and so it just could very well be that when the record is submitted to the school, the child just hasn't yet received that second MMR shot. The other point to make here is that the religious exemptions and the religious exemption rate really bears no correlation to measles outbreaks in Massachusetts. So this chart shows the number of measles outbreaks that have occurred since 2009 in Massachusetts. This is based on data provided by the Massachusetts Department of Public Health. And you see that the religious exemption rate really stays pretty steady, hovering just below, just above 1%. And, there are just, occasional outbreaks of measles. And there haven't been that many. The most being 24 in 2011. There's another spike there. It looks like it's 8 in 2014. And then it drops back down to 0 for several years. Up with a few cases and then back down to 0. And all the while, the religious exemption rate has stayed steady, right around 1%. When talking with legislators or other people really in general about the measles outbreak, we think it's really important to emphasize that we acknowledge that every death is tragic and that measles is serious. The reports that we're hearing is that it is perhaps a bit different than the measles that our parents or our grandparents experienced in their time. And we don't gain any credibility by dismissing it as something that shouldn't be taken seriously. But we should also make clear and make sure that people know that our current law protects us. The religious exemption as it's currently written in the Massachusetts statutes can be suspended in the event of an emergency or an epidemic. And there also extensive isolation and quarantine regulations that would keep children out of school if they do come down with an infectious disease, including measles. And we have learned that many times legislators don't know about this, and it's very important. And this emphasizes that eliminating the religious exemption really isn't necessary. If it were to come to it, they can exclude children from school in the event of a public health emergency who have religious exemptions. And there are rules that would keep them out of school if they're sick or contagious. The other thing to note is that legislators who support removing the religious exemption discuss pockets of under-vaccinated populations. But the fact is that these pockets of under-vaccination are largely driven by the gap. So when you have a school that is well below herd immunity for a particular infectious vaccine preventable infectious disease, by and large, the gap population is quite large. So those are the students without a complete immunization record, and they have no religious exemption. And you'll find at these schools where total uptake is lower than what you would need for herd immunity, the religious exemption rate is very low. And oftentimes represents, one or two, maybe three children. We would also urge public health officials to focus on outreach instead of discriminatory measures that exclude children from school. They can engage in social media campaigns. They can provide information on how to access health care and improve access to health care, especially in low-income areas. And no change in law would be required for them to take these kinds of measures. And we think that they would be much more effective than trying to increase the vaccination rates by eliminating the religious exemption. And then emphasizing that coercive and oppressive measures that disregard religious liberty are simply unnecessary, and they will be very harmful, and they'll be very harmful to vulnerable populations in particular. We also want to urge people to avoid a fear-based response to the measles. As of this date, which is April 15th, 2025, there have been 712 cases nationally and 0 so far in Massachusetts. For context, though, in prior years when there have been, large number of cases, just in the year preceding, there were 284 cases nationally and 1 in Massachusetts. 5 years before that, over 1,200 cases nationally and 2 in Massachusetts. And then in 2014, 667 cases and 8 in Massachusetts. So this is not something that is novel. It's not something that we haven't dealt with before. We have dealt with outbreaks in the country and in Massachusetts, and we've gotten through them. And there's the link there to the measles data that's provided by the CDC. And so if there's anything that we've learned from COVID, it's that it was extraordinarily harmful to children to exclude them from school. They lost out on their academics, they lost out on their social outlets, and it was extremely detrimental to their mental health. And this learning loss has continued. So we would urge the legislature to avoid all measures that would repeat past mistakes. And the Massachusetts Department of Public Health has emphasized that education is a social determinant of health. So it is extremely harmful to try to exclude children from an in-school education. And for context as well, we don't exclude HIV positive children from school. And there was a hysterical reaction to HIV positive children being in school. And that led to, protections for them to access their education, and groups that have advocated for them to stay in school because of how important it is. And we should treat children with religious exemptions to vaccinations in the same way, and not have a fear-based response and exclude them from school when it's entirely unjustified and unwarranted. One of the other talking points that proponents of those who support removing the religious exemption go to frequently is that there has been a 500% increase in religious exemption rates. Here again, we need to point to the statistic, the actual number of kindergartners who use a religious exemption in the state. A 500% increase makes it sound like there are thousands and thousands of children with religious exemptions, but the reality is that it's only 1.24% of kindergartners in the last school year. And the raw number of kindergartners is actually less than it was 11 years ago. And another point to make is that there has been a small increase in the number in the religious exemption rate, but that small increase has corresponded with an increase in the required doses for kindergartners. Originally it was 8, and now it's up to 20. So this graph shows you the number of religious exemptions for kindergartners since 2011 for each school year. So this is the raw number, so that you can see there in 2013, there were as many as 837 kindergartners with religious exemptions. And this year and the last year, there were 813. So it's just a manipulation of the statistics to say that there is a 500% increase to shock people into thinking that, there is this huge ballooning of religious exemptions in the state. This graph here shows the number of vaccine doses required for children entering kindergarten beginning in 1987, where it was 8, and the religious exemption rate back then was 18%. And then in 95, it bumps up to 15, and you see the religious exemption rate starts to go up a bit. And then in 2012, we're up to 20 doses, and you can see now the religious exemption creeps up to just over 1%. Those who want to eliminate the religious exemption frequently claim that it's a loophole, that those who use it are abusing it, and they use it when it's not for religious reasons, and it's clear because no major religion opposes vaccination. But this shows a clear understanding of the operative definition of religion and religious beliefs for this purpose. We have decades of United States Supreme Court precedent that makes it very clear that religion and religious beliefs are not limited to organized religion or the tenets of an organized religion. The Supreme Court has said that all sincere religious beliefs which are based upon a power or being, or upon a faith to which all else is subordinate, or upon which all else is ultimately dependent, is included as a religious belief. And we have guidance that says that religious beliefs can differ from those that are more widely held by the particular denomination to which an adherent belongs. That's not to say that it's so broad that it includes anything. It doesn't include secular beliefs, but a religious belief has to relate to a supreme being or a higher power, and it must be sincere. It's simply false that there are no legitimate religious objections to vaccination. The courts have confirmed that there are legitimate reasons for choosing not to vaccinate. Some of these include religious opposition to abortion. There are a number of vaccines that were developed with the use of aborted fetal tissue. There are religious oppositions to the use of animal products. And here again, a number of vaccines are developed with the use of animal products, even if the final product, whatever gets injected, doesn't contain those aborted fetal cells or the animal tissue. And then there are people who have witnessed adverse reactions in their children to vaccinations, and in their trauma and in their pain that they've turned to God, and through prayer they've determined that they simply cannot allow their child to receive another vaccination, and it would not be in their best interest. And it is a matter of faith and a matter of religion to not do something to your child that is not in their best interest. And that is a completely legitimate faith-based reason for not vaccinating that child. The bottom line here is that Massachusetts is protected. Eliminating the religious exemption isn't going to materially increase vaccination rates. We have such a small number of children with the religious exemption that eliminating the religious exemption isn't going to bump up vaccination rates. If it does at all, it will only because those children are no longer included in the reported rates because they're no longer at school. Parents are not going to violate their religious beliefs in order to comply with this change in law. So what we're going to have is a situation where all these children who were previously in school will be unvaccinated still and will be at church, at grocery stores, at the movies, at playgrounds, playing sports. They'll be everywhere in society except the one place where you would expect them to be, which is school. And this is clearly discriminatory against an unpopular religious belief and clearly contrary to the principles of diversity, equity, and inclusion. We would emphasize that those coercive measures are simply unnecessary, that there are other measures that are not coercive that public health officials could take to increase vaccination rates in the Commonwealth above and beyond their already, very high levels. And that would include focusing on the gap population. Again, those students who are not up to date with their vaccinations and have no exemption on file with the school. But the bottom line is excluding children from school will do more harm than good. The next bill to discuss is S-1618. This is the Community Immunity Act presented by Rebecca Rausch. Now, this bill does a number of things, including completely overhauling the religious exemptions and medical exemption process and the law pertaining to required vaccinations for school children. It also does something, completely outside of the requirements for vaccinations for school children, and it expands minor consent laws to allow minors to consent to preventative medical care, including vaccination. So to begin with, the Community Immunity Act applies to daycares, preschools, elementary, middle and high schools, colleges and universities, and camps. So distinct from the Vargas bill, the ones that would remove the religious exemption, which is only K through 12th, this bill squarely includes all of these levels and different educational programs in the Commonwealth. One of the features of this bill, again, overhauling how the laws that address vaccination mandates in the Commonwealth, is that the Massachusetts Department of Health would set all vaccination requirements for all the schools and all the camps without any kind of legislative oversight. This is a bit of a departure from current law to some extent, which includes in the statute itself, which was voted in by the legislature, certain vaccines that are required for K through 12th and then at the college level, and then gives DPH discretion only for K through 12 to add additional vaccines. So this really broadens their power and authority to add to the schedule at every level of education, additional vaccines as they see fit. Also, as far as exemptions go, all exemptions would require annual approval from the Massachusetts Department of Public Health. There's no appeal process included in the bill, and this would create bureaucratic delay where none exists right now, and unnecessary duplicative paperwork for the same child in multiple programs if they are requesting a religious exemption to attend, regular school for the school year, in addition to multiple different camps throughout the summer. They would need to get approval for every program from DPH. So the changes to religious exemptions are many. By way of background, under current law, it's very clear the exemption process is straightforward and is just between the school and the parent. The law prescribes what the parent must provide to the school, which is a written statement explaining that their religious beliefs conflict with vaccination, and they must submit that to the school every year. There's no one else involved. There's no reason to be concerned that any, privacy would be violated, and physicians are not involved whatsoever in that religious exemption process in between the parent and the school. However, under the Community Immunity Act, you would be required to use a form provided by DPH. And your child's physician or someone from his or her office, would have to sign the religious exemption form and include their contact information. This raises concerns that the physician might be tracked and could be subject to, ridicule or, adverse professional repercussions for having children who are unvaccinated to any extent in their practice. Each religious exemption would require annual approval from DPH, and as I mentioned before, there's no appeal process if DPH denies the exemption request. And it would include this statement that refusing to immunize is against public health policy and may result in serious illness or death of the participant or others, which raises concerns for parents if signing a form like that where they acknowledge that that's the position of the Massachusetts Department of Health could cause them any kind of, or expose them to any kind of liability in the future. The changes to medical exemptions are similar. Again, you'd have to use a DPH form, and that form would list generally accepted contraindications, and so those would be the only way, if your child had one of those contraindications, that would be the only way you'd be able to get a medical exemption if this bill is passed. So this is a significant departure from current law, which allows the doctor to exercise his or her own medical judgment upon examining the child and making the determination that one or any of the vaccinations would endanger the health of the child. The DPH form would also request the physician's identification number, again raising concerns that the physicians would be tracked. And doctors are already extremely hesitant to give medical exemptions. And this is demonstrated by the numbers that this year only 0.19% of kindergartners have religious exemptions. And that number has been decreasing over the last several years. Again, the medical exemption would require annual DPH approval, interfering with the doctor-patient relationship, and we don't believe that government bureaucrats should ever overrule a doctor's medical advice. The Community Immunity Act would also create this designation of a quote unquote elevated risk program. If a school falls below ideal levels for vaccinations, it would be publicly labeled online an elevated risk program, which would trigger a couple of things. First, the DPH commissioner could exclude unimmunized students from school, and this would be regardless of whether the child has an exemption, religious or medical, and even if there isn't a current outbreak or an emergency that would, justify excluding unimmunized children from school. So this is really a backdoor method to get rid of religious exemptions at these schools and shame students. And it opens the door to hostility toward religious groups if it turns out that the DPH commissioner, in exercising this broad discretion, decides to target schools with higher religious exemption rates rather than schools with extremely high gap populations that have also fallen below herd immunity levels. This designation would also trigger a requirement to notify parents and students of the designation of an elevated risk program, which is really just a shame campaign, which would incite fear and could lead to bullying concerns and breaches in privacy. Another feature of the act is that private schools could refuse to accept religious exemptions, and private schools could also require additional vaccinations. Both of these things are measures that we saw took place in the COVID era, where private schools in particular, were just deciding that they weren't going to accept religious exemptions. And even though DPH and the CDC were not then requiring the COVID vaccine for enrollment into schools, private schools were deciding that they would just require the COVID vaccine anyway. So this would sanction in the law the questionable practice of requiring additional vaccines and also refusing to accept religious exemptions. And it's somewhat ironic because Rebecca Rausch has stated that part of the objective of this bill is to create consistency in vaccine policy, but this would do exactly the opposite, allowing different schools throughout the Commonwealth to have different vaccination policies. Now, the final, but perhaps one of the most important features to address about the Community Immunity Act is that it allows minors to consent to preventative medical care, including vaccination. It does this by amending the current law, which in a section that addresses the emergency treatment of minors. This section of the law allows minors to be administered medical care in the event without parental consent in the event that failure to administer the care would endanger the life or limb of the child, which makes sense. This section of the law also includes another provision allowing for certain minors that are specified in the law to consent to certain medical care. And there are certain minors specified that are, you could argue, are akin to emancipated minors, whether or not they actually are emancipated. But if they're serving in the military, if they are parents themselves, if they are married or were previously married, then those minors can make their own medical decisions and consent to their own medical care without parental consent, without parental involvement of any kind. Then there is this sixth category of minors, and right now they can consent to any care if they reasonably believe that they're suffering from or have come in contact with one of the diseases listed as dangerous to the public health. And but they are not able to consent at this time to preventative care. They can consent to care that relates to the diagnosis or treatment of the disease, but not preventative care. There is a feature that allows them to consent to preventative care if they're sexually active, but that only relates to sexually active minors and prevention of HIV. So as it stands right now, the law is very clear that minors cannot consent to preventative care. Now, the changes that Rebecca Rausch would make in this bill would allow minors to consent to preventative care if they're at risk of contracting any of those diseases listed as dangerous to the public health. There is included in the bill and in the statute itself nothing that would limit the age of the minor or their any kind of limitation based on their intellectual capacity. There are no safeguards built into the law to ensure that the minor has the capacity to provide informed consent, and no safeguards to ensure that the minor is being given the best medical care. The physician or the healthcare provider who would be administering the preventative care or the vaccination isn't required to have a doctor-patient relationship with the child, and there's no requirement that the administering provider assess the medical record of the child or the vaccination record or the medical history to any extent. And because of where this amendment is made in this statute, Section 12F, that statute already provides that medical care provided under that statute is kept confidential from parents. And so by expanding the medical care that minors can consent to include preventative care, records of that preventative care would also be kept confidential, and parents would only be able to access it with the minor's consent or a court order. Now, this quite obviously places minors at risk. Due to their youth and immaturity, they might not know or might not be able to communicate their own medical history or their family's medical history, including allergies, allergies to vaccine ingredients, past adverse reactions that they've had, or what current medications they're taking, or what their current medical condition is. It also raises a risk that the minor would receive duplicative vaccinations because they receive one that they've already have, or let's say because their parents didn't know about it, that they previously got something that their parents then scheduled them to get another of the same vaccination. And, you know, the public health officials who develop the vaccine schedules and develop the doses do so, you know, for a reason. We're not meant to get as many doses as we can of MMR, although perhaps Merck would like that. There's a long history of precedent from the United States Supreme Court as well that upholds the right and duty of parents to make the medical decisions for their children. And as far as recent legal cases, there was a case in a federal district court for the District of Columbia that suspended a similar minor consent law that allowed minors as young as 11 to consent to vaccination. The court there suspended that law, citing a likely conflict with the federal vaccine law that requires parental involvement when minors are vaccinated. Specifically there, the federal law requires that parents receive the vaccine information statement, which includes information about adverse reactions and what to look out for and what to do and when to take your child back to the doctor. And if the parents aren't involved and aren't present when the minor receives the vaccination and don't know anything about it, then the doctors can't comply with that requirement to deliver to parents the vaccine information statement, thereby creating the conflict with federal law. So that law was struck down. So we expect that based on that precedent, Massachusetts would be subject to a similar legal challenge, and the lawsuit would likely prevail. As far as Massachusetts law goes, with some exception, the current law in Massachusetts requires that parents provide informed consent on behalf of their minor children before medical treatment. This is a common sense requirement. And it's very interesting because there has been this push to, quote unquote, raise the age, which refers to legislation that would raise the age of criminal majority from 18 to 20 or 21. Allowing 18, 19, and 20-year-olds to be processed through the juvenile court system in the case of criminal activities. And the basis for this movement, according to its proponents, has been that the brains of juveniles are not fully formed, they're not fully developed and fully mature until 25. So it stands to reason that if they aren't capable of being tried as adults, even at 18, 19, and 20, and their brains are not then mature, they should also not be making permanent, lifelong medical decisions that cannot be changed. So the bottom line here is that the current law protects minors, and expanding minor consent laws places them at risk. The legal challenge based on the District of Columbia precedent is likely to prevail. The current exemption system works. We have a system where the information is exchanged only between the parent and the school. There is no delay. Students are able to continue their studies. There is no waiting period. There is no concern of uncertainty in the event of a denial from a government bureaucracy. And this respects the doctor-patient relationship as well. And finally, while claiming to keep the religious exemption, the bill actually allows for its removal of the religious exemption and medical exemptions if the program becomes an elevated risk program. This is an unjustifiable removal of healthy children where there's no emergency, creating all of the concerns that the removal of the religious exemption bill creates, which we've just discussed, excluding children from school, the mental health issues associated with that, the inability to homeschool, especially for disadvantaged or disadvantaged children or those with special needs. And that our current law protects us in this situation. The religious exemptions can be suspended in the event of an emergency, and sick children are subject to the quarantine and isolation regulations. So, making this provision entirely unnecessary and unjustifiable. The final bill here to oppose is S 1244 and H 1815. These are known as an act enhancing abortion care, but everybody should know that it's not just about abortion. These bills include the same minor consent provisions that we've just discussed in the Community Immunity Act, which would allow minors to consent to preventative medical care, including vaccination. As you can see here, this is a snapshot of the language that would be amended in Chapter 112, Section 12F, where it expands a minor's ability to consent to the prevention of such disease that they believe they're at risk of contracting. And we are at risk of contracting virtually any illness at any time. And then down at the bottom, this bill has the additional feature of deleting the part of the law that generally prohibits minors from consenting to sterilization. So right now the law says that consent shall not be granted under the paragraphs above for abortion or sterilization. But with deleting that sentence altogether, it leaves unclear when minors and which minors could consent to sterilization.